Hello, everyone. Welcome to the Kiltz Health live stream with Dr. Nelson. I am your host, Dr. Nelson. And please let me know in the comments where you're watching from. I am in Central Florida. And Dr. Ana Rosa is coming from your Nebraska, right?
Yes, I am in Nebraska.
Uh,
Yes.
so today we have a truly special guest who bridges the gap between the precision of medical imaging and the depth of the human spirit. Joining us is Dr. Ana Rosa Gratitude, like that she did put that name there. She is a physician, a radiologist, and a PhD with over 30 years of experience from looking inside the human body for decades to navigating her own journey of healing and resilience. She is here to share her ancestral human nutrition story and how she transformed grief into a mission for metabolic health. Dr. Ana Rosa, welcome to the live stream.
Thank you, Dr. Nelson. I'm always really grateful to be here with you, to be here with your audience. Yes, so here I am, and I want to share a little bit of me and my story and how I was able to lose weight and how I am being able to reverse disease and to build sustainable success. So, if we start, I wanted to say that through my whole life, I have always struggled with my weight. I was always like losing weight, gaining weight, losing weight, gaining weight. I had times in my life that I was 125 pounds. And if I look behind, I am pretty sure I wasn't healthy because I didn't have much muscle and I wasn't a person who would like doing strength training. And now we know so well how much muscle is what really keeps us healthy, alive and independent. In 2016, I was here in the United States and my husband died from colon cancer stage 4. This picture was taken by my brother-in-law who was here with me 1 week after my husband died. And you can see in this picture that I had a lot of inflammation. My face was very red, lots of rosacea, extremely overweight. I was at 226 pounds at this time. I I am able to say for sure that this was the worst time of my life. I had like unbearable pain. I was broken. I was shattered. I was destroyed. And I couldn't imagine that I would be here today with you 10 years later because I couldn't imagine I would be able to wake up the other day. I would wake up early and go to work because I had to pay my bills. And I would come back home and I would eat and eat and eat everything, not even knowing exactly what I was eating because I just wanted to numb my pain, my sadness, my longing, my grief, my anger, my guilt, my shame. And then I would sleep again. And that was my vicious circle for more or less 9 months. And then one day, and I'm going to share something really heavy here, everyone. So I hope you don't get very upset or first or anxious. One day after these 9 months of this life that was horrendous and miserable, I was sick and tired of being sick and tired. And I had a friend, a plastic surgeon who had died by suicide. And I gathered all the things I needed to eliminate my life the same way he did. So I was in my bathroom and I was looking in the mirror and I had the surgical material and I had the lidocaine and I had everything. And my dog was very anxious and I stopped because of my dog. And then I looked at my dog and suddenly I kind of thought about my grandma when I was younger. Like when I would feel afraid and scared. I was around 7, and my dad, my mom were divorcing, and my grandma would always tell me, "Talk to God, talk to God. He's gonna hold you in your hand, in His hands, and He's gonna hold on to your hands." So in that split moment, and that didn't take like 3 minutes, I kind of looked in the mirror and started crying. And I did not pray. I did talk to God. I said, "God, I need your help. I need you to hold me because I can't do this anymore. I can't live this life. I don't know why you brought me here to the United States as my husband died. I don't know what I'm doing here. I can't do this anymore." And God helped me. And I started researching about grief, and I started researching about gratitude, and hello everyone. And I started learning that grief is my teacher, and that gratitude would be my bridge and is my bridge to life again. And in that time, from 2016 until 2020, I did lose weight. I walked through the paleo diet, low carb diet, keto diet, Dr. Gerb diet with 7 portions of veggies, and fasting, and like supplements and all this kind of stuff. But I would always gain weight again. I was 100. I started to 126, then I went to 178, then I would go to 198, then I would go to 206, and I would be like that in this yo-yo pattern. Until one day, again, God enlightened me, and I was already learning about visceral fat and all the strategies from Dr. Sean O'Mara that worked with me and is my friend. And but I wasn't really like getting sustainable success. Again, I was in the yo-yo pattern until one day I realized, wait a second, I have been walking this journey of grief knowing that there is no final destination for more or less like 8 years already, 7 years, 6 years already. And everything that I have learned from grief is that I cannot heal and I cannot get progress if I don't walk through the pain, if I don't question the pain, the doubt, the self doubt, the false belief, the false stories. And that's when I start shifting from pain to peace, from fear to love, from scarcity to abundance. And I realized, well, that's the same thing for my health, for my weight loss, for reversing disease. Every time I am sabotaging myself, every time there is something holding me back, is related to a trigger that leads me to the fridge and leads me to eat my pain, eat my trigger, eat my emotions. And I just have to stop the same way that I do with grief, knowing that there will be no final destination because this is who I am, and question question, am I hungry? Am I thirsty? Or do I only need a hug? And that's why I always say I'm sending a hug from my heart to yours, because everybody needs a hug. Everybody's going through a difficult situation at some point throughout the day, or a struggle, or a trigger, or a self doubt, or imposter syndrome, or a feeling that you're not good enough, whatever, right? So, whenever you are in this situation, instead of numbing yourself with the food, with alcohol, with any kind of addiction, or anything that doesn't love you back, pause and shift. That's why I say in my program that I call the unhindered life, the life that is free from what's breaking, holding you back, or from what's sabotaging you. Like every time you are in this situation, connect to your soul, because you are a creation of God. You are wonderfully and fearfully made. You were born with joy, with love, with goodness, with light, with wisdom from the Creator. So every time there is a trigger, connect to your soul, ground in your heart, in the in the wholeness that you are, and challenge your mindset. Really ask the reminders, the triggers, the fear, the thoughts that are not yours, if they are true, if they are really true, and what are they preventing you to have in your life if you keep acting on them. And they've served at some point. They have served when you are a child or when you were going through abuse. So grab all the feelings, all the thoughts, all the false beliefs, all the false stories, all the fear, all the doubt. Embrace them. Put them in your jar. You are loved because they kept you safe, but they don't belong to you anymore. They are not serving your but bigger, higher version anymore. And learn from them. So the grief, the triggers, they are teachers, they are reminders, and connecting with gratitude from them, from the life that we have, we are able to challenge our mind, shift the perspective, and build sustainable success for our bodies through like nutrition, movement, hydration, stress hormesis, and everything. Because I know that. I know because I was here, and this is my first abdominal MRI. And as you already know, all the white inside the abdominal cavity is visceral fat, and this portion here is deep subcutaneous fat. All this fat is inflammatory 24/7, cytokines, cortisol, high insulin, insulin resistance, high sugar, prediabetes, diabetes, and damaging your brain, resistance, insulin resistance, and brain fog and forgetfulness, and everything else, and cancer and low muscle. And I also had, this is my abdomen, this is not my brain, but again, if you do not take care of your health, your inflammation, your brain shrinks, and you have all the cerebral sulci widened, and you have small vessel ischemic disease and microinfarcts in the white matter that lead to vascular dementia. And you could have fatty liver, which I did have, although this is not my liver, but you could have fatty liver. And I'm so grateful that I am a radiologist and I can see all these every day. And you could have fat surrounding your heart too, which is also inflammatory, and it's the epicardial adipose tissue. But I want to tell you that when you claim your power, when you claim your energy, when you challenge your mindset, when you go without perfection, with progress, and you build a plan that is sustainable, you are able to do like I did. You are able to go from fat surrounding your heart to zero fat surrounding your heart. Here's my heart, zero fat. You are able to go from lots of inflammation and not much muscle to less inflammation, less visceral fat that I still have, but way better muscle mass. And I am in menopause, and I have hormone replacement therapy. That is another important thing to be uh, aware about. But I was able to build muscle, and that's it. This person is not different from this person. Both of them, or I, have the same fears, the same doubts, the same false beliefs, the same false stories. The difference is that this person was walking unconsciously and numbing everything. And this person decided to take charge and decided to question everything that was holding me back and claim my power, shift the perspective, and walk changing, building changes by changing my choices and asking myself at every time for everything you are going to do, ask yourself, does this love me back? Does this choice align with the life I want to create? And yeah, ask if it's good for your brain, if it's good for your health, if it's good for your relationships. And this is me in a nutshell. And this nutshell here now is what I love being a radiologist. I have been a radiologist for 28 years. So I love being a radiologist. And I also want for us to build a revolution for health and life together. Sharing love, sharing light, sharing goodness, sharing knowledge, sharing wisdom, sharing clarity, sharing guidance. And that's why I'm here talking to Dr. Nelson, because that's something that is really important for my heart, brings me joy. And it's just so good to see that we can build connection, that we can build friendship, and that we can be alive and healthy and functional together.
Thank you, Dr. Anna. If you have any questions, I think you may have another tab open. I hear a feedback.
All right.
Uh,
I have Instagram.
you
No, not Instagram. I'll
no?
close Instagram.
Okay. Uh, just want to remind everybody that we are medical doctors. Dr. Anna is a radiologist. I am a family physician. I am actually a recovering family physician and a metabolic health practitioner. Uh, but this is for educational purposes only. This content does not constitute medical advice, diagnosis, or treatment, and no doctor-patient relationship is being formed. Always consult your healthcare provider before making any changes in diet and any treatments. Just to be clear, okay?
Yes.
And do put your questions. I know there are some comments and questions I want to highlight. I will get to that in a moment. I just wanted to have a couple of announcements. If many of the people that are in the chat right now are certified health coaches, Kiltz Health certified health coaches. And how did they do that? They took our course. If you want to take our course, the link is usually in the description, but you can go to drkiltz.com or you can sign up with to the Kiltz Mighty Tribe. It's easy to find. In all the descriptions of the video, there is the address. But if you don't find it, you can just search for Kiltz Mighty Tribe and you will find it. Also, you can go to drkiltz.com and you'll find a link getting you back to the Kiltz Mighty Tribe. Kiltz Mighty Tribe is free for everyone. All we ask is your email address so we can connect you to the community. And otherwise, it doesn't cost you anything. If you're interested in coaching guidance, we have also an introductory price of $39 for a health coaching call with one of our certified health coaches. And you can ask for information either here in the chat, or if you go to the Kiltz Mighty Tribe, you will find the links. Okay. I also wanted to point out that let's see, our next events. We're gonna be on April 6th at the showing of the Cholesterol Code film screening in St. Petersburg. And if you want to buy tickets, go to kiltzmeetup.com and you can find your way to this particular event. We are also going to be, and Dr. Kiltz and I will be there, Dr. Ovadia, Dr. Boss, Susie Boshoff, and there might be a few other people attending. Just go to kiltzmeetup.com and you will find the information. April 11th and 12th, I'm going to be in Long Island and Queens. We have two events there. One of them is Christopher Brandling's event. The other one is with me and Lois Lotito in Queens. We're going to go and watch a Mets game and we're going to eat at a Korean barbecue place. And then April 22nd, we are going to have a screening of the cholesterol code. Also, this time in Orlando. And you can go and find tickets through the kiltzmeetup.com website. Okay. And all
And I
right.
want
So
to say that I am enrolled in the Dr. Kiltz Carnivore Coach together with Dr. Nelson. And I want to tell you all, whoever hasn't enrolled yet, and if this is something that resonates with your heart, it is an amazing course. The knowledge, the details, the explanation, the guidance, it is outstanding. I am loving it. It's being a review for me because I'm a medical doctor, but it's also being new knowledge that I'm learning because I forgot and many things have been updated as well. So the course, the carnivore course to become a coach is amazing. You're going to love it. And the community, I have met Dr. Nelson in person, Dr. Kiltz, and many people from the community in the last meeting in Tampa, Florida. And I felt like I was at home. I felt like belonging. And that's the most important thing for life, to not be isolated and to feel loved, seen, heard, valued, and honored. The community is a blessing. Yes. Thank you so much.
thank you for those words. They were not solicited, but the check is
No,
in
they
the
were not.
mail. Uh, I have a comment here. United Carnivore, Dr. Anna, you were a great addition and speaker at Kiltz Meetup in February, and hope you can attend many more. Thank you, Carnivore.
Yes,
Carnivores Unite.
and I am coming to Albany, New York, and I'm going to be speaking there. Dr. Nelson and Dr. Kiltz are giving me the honor to speak there again. And I'm also coming to speak in Chicago. I know Albany is May 30th, and Chicago is July something. I forgot. I forgot
July,
Chicago.
I,
Yeah.
I believe it's July 25th.
Yeah, yeah. So yes, I'm gonna be in both of them, and I would love for all the people who could be there to be there, so then we can meet each other in person.
All right. I'm going to take some questions here.
Yes.
Uh, let's take them in order. We'll see.
Okay.
Okay. So this is not so much a question, but a comment. But my carnivore lifestyle says, and this is Christina without the age, Dr. Anna, that is amazing that you were able to pick yourself up and change your life. Such an amazing story.
Thank
And
you. I
sometimes we go through struggles, uh, but that allows us to come on the other side better and improved, right?
Yes, and each one of us has the same power, has the same knowledge, and the same wisdom in your hearts. We just have to pause, breathe in, breathe out, calm. So then the stress gets out of blurring our vision, and then we are able to move and take one step at a time. Yes.
All right. This one is uh, also a comment, but I wanted to point it out because Uncle Charlie has an amazing story. I was 325 pounds, now 180. A1C was 18,
Wow.
now it's 5. Hospital for 14 days, 7 days in the ER, fatty liver, kidney, heart, pancreas wasn't working. They asked me, "How are you alive?" And I said, "I don't know."
Well,
And
you are alive because you were supposed to be here today giving this testimony of life, right? For carnivore.
yeah, there's a follow up on that because he didn't have enough space to write the whole comment. The doctor said insulin and metformin for life. She was wrong. When I went back, she said, "Don't know what you're doing, but keep it up.
Yes, Charlie, keep it up. And more than that, do exactly what you're doing now, writing down and bringing your story up, speaking about your story out loud more and more and more for everybody around you, because we definitely need to debunk the myths that we were taught and that we had believed for so long to really build a difference in life. Look at Dr. Nelson behind there in his pictures, how he was very ill and not even being able to walk. And now he's here teaching, guiding, mentoring, right? So, yes.
All right. So in these channels, we are normally talking about carnivore, keto. We're talking today about grief and gratitude, which are very important. We talk about sleep, exercise, grounding, sunlight, right? Uh, Once in a while, there are some questions that have nothing to do with that. So I'm taking, I'm going to go ahead and take this question. I imagine that Cast Blast 1989, it might be new to these channels, but what do you know about thoracic outlet syndrome? My question would be, what do you want to know? Because, I mean, it doesn't take much, but Dr. Anna, you see these often, and probably as often as or more than I do, because you're a radiologist and you interpret frequently. Probably the most accurate test to diagnose this in your field will be an MRI, right? So tell us a little bit about thoracic outlet syndrome for Cast Blast 1989.
So, Cast Blast 1989. I am a radiologist, but I don't read much vascular exams. But I'm going to focus on remember what I have learned because I haven't read this for a while. But it's a compression of your vessels in the area of your upper chest here and your shoulder. So it's because of the vertebra and it's compressing the artery and also the vein. And because of that, you have, when you are exercising, when you are moving your arm in different positions, and that's one of the techniques that we use to kind of diagnose. We move your arm and we see if there is decreased flow and increased resistance. So you have numbness on your arm, you have numbness on your hands, you have numbness in your fingers, you have decrease of your strength. So that's what I know. Dr. Nelson probably knows more than I do.
Well, that all that was very accurate. You can usually somewhere from the neck to the shoulder here, because arteries, veins, and nerves
Course
go
together.
in sort of a bundle through there. When you have a compression of either one, you're going to have symptoms of either circulatory problems, numbness, tingling, pain, and the treatment usually has to do with medications or
Resection.
physical therapy and ultimately surgery to decompress the area. So that's a now you had a complete
Wow.
class on. But
Glad.
if you're having any of those symptoms, it could be something weakness without having much of the other symptoms as well. So it depends what's being compressed the most. Is it the vein? Is it the artery? Or is it the nerve? And they, just compression on any of those will probably give you the symptoms I spoke about. But if you have any, if you think you're having something like that, obviously go and consult your doctor. And I'm gonna go ahead and get this out of the way because he also asked about fibromyalgia, and that is probably a bigger topic to speak of because a lot of people have fibromyalgia. I have a little pet peeve, and this morning the doctor did mention something about fibromyalgia. We had Dr. Driscoll in the morning live, and that is that sometimes fibromyalgia is overdiagnosed because the diagnostic criteria includes a little statement that says, unless the symptoms can be attributed to another condition. And even rheumatologists who basically came up with the criteria, listen, if you have rheumatoid arthritis, if you have polymyalgia rheumatica, if you have anything else that explains the pain, it shouldn't be diagnosed about as
Wow.
fibromyalgia. But anyways, that is a topic for a very long lecture or visit. Sometimes it is painful, and again, you need proper diagnosis. You should go and see your doctor. All right. And cast blast, I don't know what that means. If it has anything to do with cast iron pans, email me, Nelson at drkiltz.com. I want to talk to you. All righty. Uh, CB, it's not a question, but it's a comment about what you were talking about. That mindset switch is only an arm length away. Just reach and feel the power of the real proper food will give you, or will give your brain, and it's easier than your current sick mind now believes. Thank you, CB.
I would
See,
say that everything is uh, a different resource and a different tool that you put all of them together. Because, yes, the real proper food will give energy to the brain and help in healing the mindset. However, you have to be aware and focus on your mindset because the mindset will sabotage your behavior and hold you back if you don't use your energy to challenge and shift your false beliefs and your old patterns. It's like if you could work the house temperature up to 100 degrees if you're by turning on the oven, by opening the doors, by, whatever, turning on heaters. If your thermostat says 69, your house will come back to 69 whenever the other things are not working properly or whenever, so you have to raise your thermostat to the level that you want to be in energy. Otherwise, you will be here for a while, but you will come back here. You will come back here. Yes.
mindset is first, and Dr. Kills like to talk about faith, fat, and fasting. The three
Yeah.
F's, but faith is first.
Yes.
Anyways, faith focused food freedom, another one of our
Karen!
Kiltz Health certified coaches. Karen, you answered this, but she was asking. So, will you be speaking or attending any upcoming meetups? I would love to see you in person again. And yes,
Yes.
Dr. Anna will be in Albany and Chicago. You can find out about those meetups in kiltzmeetup.com. Kiltz Meetup, not plural, but meetup.com. And or our all of our events are there. We keep adding or changing as the time progresses. And hopefully, we will have there a screening for Healing Humanity. Now, they are very close to release all the details. Stay tuned, but we're going to do one in Florida, a screening of the Healing Humanity. Hopefully, will be probably Orlando or Tampa, maybe Miami, or maybe a screening on all of those places. Uh, so we're getting close to knowing exactly more details. If you're going to Midstock, guess what? You're going to be able to watch Healing Humanity in Midstock. It's
And
an
me too.
exclusive. And you're going to Midstock, right? All right.
I'm going to, I'm going to meet Stock and I'll be speaking there too. Yeah.
So May 1st, 2nd, and 3rd, that's Meatstock. I will be there. Dr. Kiltz will be there. And we hope to see you there as well.
And I want to
All
say thank you,
right.
Karen. Karen is an amazing coach, an amazing person, and she's part of my challenge this month of March, my community. And I'm so proud of her. She is amazing. She's outstanding. She inspires everyone in the group. Thank you, Karen. You are a blessing.
All right. So Juliet, Coach Juliet Edens, and she's also one of our
I love Juliet.
Kiltz Health certified coaches. She's asking, what is Dr. Anna YouTube channel? A dose a day of Dr. Anna starts our days with inspiration. So
Oh,
Dr. Anna is not exactly very active on YouTube, more active on Instagram, but you do have a YouTube
I
channel,
do.
right?
Yes, and
Okay.
I am kind of making it more alive. So it's the same as Instagram. Ana Rosa, gratitude.
Okay. So,
Thank you,
and then let,
Juliet. I'm looking forward to talking to you soon.
all right. So, my carnivore lifestyle, Christina is asking, how did you begin this transformation? What was the first step? How did you keep going? It can be so difficult.
Yes, Christina, I did begin this transformation because of grief. I began the journey of grief when my husband died from colon cancer. That was in 2016. And I was defeated. I was broken. I had this unbearable pain. I was suicidal. And if I did not do anything, I wouldn't be here with you today. So that's when I began learning about grief and learning that grief has no final destination. That grief is a wave, right? That sometimes puts you up and sometimes drowns you. So by understanding that, and by focusing on asking the questions, is my husband really lost? Or where is my husband? Or how can I connect with my husband? Or why am I longing? Why am I missing? Why am I sad? Because I am missing my husband. I am missing my life that I don't have anymore. But why am I missing? Because of the love. So as I kept asking and asking and asking deeper questions, I was able to see that the foundation of my pain was the love. The love that I didn't have my husband in the physical body anymore. So I became building gratitude for the love, gratitude for the life that we had together. And I began like practicing gratitude. And one day at a time, one step at a time, many days worse than others, some days better, I started challenging everything that was painful by questioning and grounding with gratitude. And I started increasing my awareness, my love, my compassion, my connection with my husband, with my love for myself, with my faith. So then I started losing weight, but I wasn't reversing disease because, like I said before, every time I would have a trigger, not only from grief, but like I would be bored or I would not be wanting to do something or I would have a problem at work, any kind of trigger, I wouldn't really even elaborate it. I would go straight to the fridge. I would eat like a gallon of ice cream. I would eat a huge pizza. And I'm not kidding. I wouldn't eat like two slices of pizza. I would eat like four, and then later on I would eat the other four, and sometimes I wouldn't even have space to eat them, but I would eat and I wouldn't even feel the flavor. And that's when one day when I was opening my fridge, I stopped and I'm like, wow, I am not going to be free from this journey of health ever because it's a journey without final destination too. There is always room for improvement and I don't want to get back to where I was anymore. On the same note, I will always have these triggers because these triggers grew up with me because they were conditioned by my environment. My dad left, there was the fear of abandonment, the fear of not being loved, not being seen, not being heard. or the imposter syndrome, right? So the same way I had to question all the things for me to keep healing from grief, knowing that one day would be easier and another day would be harder, I understood that I had to question the triggers that were making me eat when I did not need to eat. So, questioning, am I hungry? Am I thirsty? Or do I need a hug? Right? Because you can hug yourself. And how do you hug yourself? When you realize that you are eating your emotions, you stop, you go get a shower, you turn on a song and you sing and you dance, you go to the sun. If you stop for 30 seconds, you broke the the link in your brain. You broke that neural pathway. It doesn't even need to be more than 30 seconds. You broke the neural pathway and you are building through neuroplasticity a different connection, right? But it hurts. It is hard. You have to do it over and over and over again. You have to understand that there is no final destination. There will never be a day I'm not going to miss my husband. There will never be a day that I'm not going to have a food trigger. But some days I might kind of like not be too strong and win over them, and other days I'm going to challenging until I get stronger and stronger. And then the triggers will come less frequent, and the triggers will less will be with me for less time, right? And it is difficult, but it is way more difficult to live an unconscious life that you are trying to bury the pain, and then you're getting sicker and sicker in your mind, in your soul, and in your body, and you don't exactly know what's going to happen if you keep getting sicker and sicker, right?
That is correct.
And I love Dr. Nelson. I do. He's a blessing from the universe for me. I don't even know how I got to meet you, to be honest. What is the best thing you can do for brain health? Any recommendations? There are so many amazing things that you can do for brain health. But I'm going to say one. I'm going to say five, okay? So the first one, which is the one that we don't give much attention, is community, socialization. Isolation kills your brain. Isolation makes you depressed, anxious, with fear, and also with lack of memory, cognition, decision, attention. So isolation is extremely, extremely damaging and detrimental. So any kind of connection. But if you are able to call someone instead of texting, or if you are able to be with someone even for 5 minutes, is even better. That's why the community, Kiltz community, is amazing, because they do have the meetups, and you guys definitely meet each other and are a community of belonging. Second, sleep. Prioritizing your sleep is fundamental. During the REM sleep, you are building memories, you are building, organizing your thoughts, your ideas. And during the deep sleep, you are cleaning your brain and you are regenerating all the cells of your body because of growth hormone. So sleep 7 to 9 hours a day, cooler room, warm shower, disconnecting from food, water, and electronics 3 to 1 hours, and enjoying the sun. It's also amazing. Walking, particularly after your meals. There is a new study that I want to read that a neuroscientist, I forgot from where she is, because I got to see this study on LinkedIn and I want to go back and check. She did a research with people who had uh, cognitive decline, and she was able to see that the people who walk, especially after a meal, and especially between 2 and 4 p.m., are the people who have less cognitive decline from all the ones that they evaluated. And strength training, muscle is brain, muscle is mood, myokines, muscle is brain neurotrophic derived factor, and vitamin B12 is good for decreasing brain atrophic changes. I'm learning with Dr. Nelson too.
So Brian Ari, who was asking a question before, made a comment. When I let gratitude in, it came with delight.
Yes, I love that. There is a saying from Rumi, where the wound is where the light comes in. So that's true, you know. Or kintsugi, where you are broken, you can go there and you can put the pieces together with the gold of your light, the gold of your soul. What I would say is that whenever you are broken, shattered, destroyed, do not get all the pieces back. You don't need all of them. When you are broken, you have the chance and you have a gift from God to build different. So you look on the floor at all your pieces and you say, I want this one, I don't want this one, and then you release this one because where you are releasing this that you don't need doesn't belong to you anymore. You can build a new tapestry that you are going to look at the abundance of the universe and you are going to get something better and you're going to connect better. So, yeah, build yourself the way that you deserve.
All right, so this is not a question, more of a comment, but I want
Mhm.
to highlight it. Uh,
All right.
Ribeye fly trap. I have severe Ehlers-Danlos syndrome. By the way, we spoke a little bit this morning about EDS and was working with doctors to get assisted suicide in Canada before the carnivore diet. I completely understand how you feel and cherish your story about God. And he credits, in part, the carnivore diet to pull him out of that.
I
It's a
am
very,
really grateful.
very dark place to be in.
Yes. I'm really grateful that you are here with us. I'm really grateful that you are saying yes to you, to your life, to your healing, to your faith. And we are together. We are humans. We are all similar. We have the same pain. We have the same doubts. We have the same fears, just in different containers. But we are here to hold on to each other, right? So let's keep walking this journey together. Thank you so much for your care and your hug. I got your hug in my heart.
All right. So this next one is a question that's very often asked, in particular to people who are carnivore curious and may not have done much research yet. And the answer sometimes is all over the place. But uh, so Vampire G9F, she's asking, or he's asking, do you need vitamins on carnivore? What do you think, Dr. Ana Rosa?
You know, I am going to answer to you, not really because of the carnivore or not carnivore. I built my health package, and my health package is not negotiable. And I do once in a while have some blood tests just to see how I'm doing. In my health package of non-negotiables, I have protein, my daily protein. I get to my daily protein no matter what. And if I'm not getting my protein in meat or eggs or whatever, I'm going to get my protein with a cup of natural yogurt and protein powder of good quality. Mind Body Green, Equip, whatever. I do get, it's not the main source of my protein, but I do get my protein no matter what. Vitamins, I do get a good multivitamin complex, and I like doing it because I just got diagnosed with ADHD some time ago, and I got to understand that it's really important, vitamin C, zinc, uh, to be a good balance, you know. So I get my vitamins, and vitamin B12 and B3 and B6 and B9 are so important for the brain. So I do get all these vitamins in a multi-complex vitamin. And what else? Um, I do get extra magnesium because I get the magnesium in the morning that is the althionate that cross the brain barrier, blood-brain barrier. And I do get magnesium at night with L-theanine that helps me with my sleep. So these are the additional ones that I get. Oh, and I do get uh, lithium. I get a very low dose of lithium. Um, I forgot the name. It's not the lithium for psychiatry. It's anyway. It's very minimal. And again, this is not medical advice, but I had done some research and and heard really amazing people like Sean talking, or like the age management conferences that I have been, that minimal doses of lithium are very good for your memory as well. So I do take that. And and I do have hormone replacement therapy. Although my mom had ovarian cancer, I am genetic positive for cancer, and I did have cancer myself, but I do have my hormone replacement therapy, and I do my monitoring with my doctor, because I believe that the risks with again, not medical advice, this is me. I believe that the risks for anything by having hormone replacement therapy, when I am monitoring them closely, they are way less important than the benefits that the hormone replacement therapy brings for me. Again, I am very well monitored. I am a doctor, and I am assuming my risks, and I follow them very closely.
Is the lithium that you take the orotate?
Yes.
Okay.
Thank you. I couldn't remember the name. Yes, thank you.
All right. Uh, a
How
reminder
about
if
you?
you
Do you think we need vitamins on carnivore? You are way more knowledgeable about that than I am.
you gave a very good review. I do take some supplements,
Yes.
and as far as vitamins is concerned, vitamins, not minerals. The only vitamin I take is vitamin D because it was low.
Oh,
So
yeah.
this is the thing with supplements. And in a previous life, many years, I mean, I've been a doctor for 41 years. So in a period of my life, actually my office was called Family Medicine and Holistic Center. I was a lot bigger in supplements. The problem with supplements in general is sometimes we're taking this and that and that and that, and we're spending a lot of money on things that may improve you. And there is always some evidence, even if it's small, that this supplement helps. But you have to be careful with having too many supplements. You're going to create the same polypharmacy problem that you do with the medical establishment by prescribing you a bunch of stuff. They can have interactions, and so that's my warning. And I'm not against anyone taking anything for specific purpose, but I prefer, when I advise people, if you're going to take a supplement, let's find out if you're first of all deficient,
Yes.
or do you suspect any deficiency because you're having a certain number of symptoms, right?
Mm-hmm.
Because taking a supplement just because someone said take a supplement might not be the best idea. Do I take some supplements? I do. Okay. Uh, as far as the vitamins, the main ones are the vitamin D because I was low. And I live in Florida, by the way. Everybody in Florida is still low in vitamin D. It's very important for so many things. And
Yeah.
by the way, what do you need to make vitamin D? You need cholesterol. Okay. Vitamin D is just two steps from the cholesterol precursor. Okay. So that's my answer with the with supplements, vitamins, minerals. I do take magnesium, and I'm having some electrolytes
Yeah.
here. So I'm not opposed to, but just for the heck of it, uh, I don't advise it. You have to be careful.
Yes. Agreed.
If you have any other questions, please put them in the chat. We're coming to the uh and yeah, I haven't even read it completely, but I'm gonna point out this answer. And CB Carmack is also a Kiltz Health certified coach, and I think the answer, his writing to the other person, are you vitamin deficient? That's the answer. Check
Yes.
periodically, meet an expert by vitamins in their most bioavailable form. I only take D3K2 every so often, but none else besides magnesium.
Yes.
And many people in the carnivore world will tell you you don't need anything. And they do have a solid base to say that. So,
I think the major wisdom in this paragraph is check periodically. You check, are you deficient in vitamin D3? Are you deficient in magnesium? Are you deficient in the things that are most important? And then you go and you supplement, like Dr. Nelson said. Good
uh,
morning, Setsuko.
Setsuko, she is in the other side, on the other side of the globe. Good morning for her, Dr. Nelson and Dr. Anna. Good to see you here. All right. If you have any other questions or comments, put them in the chat. I want to, let's see, let's bring this up. If
Oh,
you want to connect with Dr. Anna, go to her Instagram, which
and the
is
YouTube
this
is the same. Ana Rosa Gratitude
Anna Rosa Gratitude. And you do have another Instagram, by
for
the
Portuguese.
way.
Yes, I
Okay.
do. So
All
be
right.
careful that you are not choosing the Portuguese one. Ana Rosa Gratitude.
Unless you speak Portuguese.
Yes. Ana Rosa Gratitude is English. Ana Rosa Gratidão is Portuguese. YouTube is going to be only one channel, the Ana Rosa Gratitude. My intention is that I'm going to post short things on Instagram, and then I will do once a week a live of 10 or 15 minutes just to discuss the topic that I gave some sprinkles throughout the week. Yes.
All righty. And if you want to find her on YouTube,
Yes.
this is her channel.
Thank you.
All right. And as you can see, I'm subscribed to it.
And there is us, Dr. Nelson and Dr. Anna Rosa Gratitude.
Yes, because you're streaming on your channel as well.
Yeah. And just before we finish, I want to say again, and it's not solicited, the course, the carnivore course from Dr. Kiltz and Dr. Nelson in the Mighty Tribe is really amazing. The information is super updated, detailed, and you have the live sessions and you have the reviews in video and audio, and it's amazing. And the community is a blessing. Yes. And I am
Uh,
honored to be part of it.
and there are more things to come, including a course I'm preparing on fasting. It's going to be a 3 hour course. I'm still setting it up. So maybe, do you do any fasting? That will
I
be the
do.
last question.
I do. In
Okay.
fact, in this last Christmas, I finished on December 25th a 10-day fasting.
All right.
I did a 10-day fasting in December.
So
It was amazing. I need to
we,
go back to that.
maybe we'll do a course on fasting together for the Portuguese
Yeah,
audience.
that would be awesome.
All right. We'll be inside the Kiltz Tribe community at 5:30 in our Thursday Zoom call. Go to Kiltz Tribe. You'll find the Zoom link there. You have to be a member to come to that, and membership is free. Okay, so you have a great day. Eat meat. Thank you, Dr. Anna,
Thank you.
for doing this.
Thank you.